Psychiatry, Psychedelics, and the Future. In recent years, the practice of psychiatry has shown a growing interest in the use of psychedelics in treating a wide array of mental health issues. And while the legality and validity of this trend remain in debate, there is a long history of both natural and artificial psychedelics having a profound effect on psychiatric patients. The history. It is a widely accepted truth that the push to ban the use of psychedelics was directly related to Vietnam-era anti-government sentiment. In fact, it is possible that this was the first spark in what would later become the war on drugs. Indeed, the history of psychedelics, politics, and psychiatry is a long and storied one. The first thing to note is that since 1971, psychedelics have been globally classified by the UN as Schedule I substances. This means that individuals in the medical field can indeed prescribe them for research while utilizing them for clinical trials, but they remain illegal for all other uses. Of course, most people will note that there has not been much research in this area until recently. This is most often attributed to the stigma surrounding psychedelics that labels them purely as recreational drugs. Indeed, funding for scientific studies on the effects of psychedelics to treat mental illnesses was rarely forthcoming as well, as companies sought to distance themselves from such a problematic class of drugs. However, much of this is changing now. Indeed, psilocybin is quickly earning a reputation as psychiatry's new wonder drug, with the potential to treat everything from eating disorders to depression and anxiety. As of this writing, there are two major clinical trials taking place around the world, in which the drug is specifically being used to target depression. While it might take years for us to get our hands on the results of these studies, some of the smaller clinical trials we've seen seem to indicate that they will ultimately prove successful. However, many individuals aren't waiting for science and have started self-medicating with psilocybin via microdosing. This involves taking minimal amounts of a drug in order to avoid full-body effects while still enjoying the mental and cellular benefits. How psychedelics actually work on the body. There is significant evidence that psychedelic drugs like psilocybin actually change your brain. This is because these substances often mimic our happy chemical serotonin, while also interrupting a specific network in our brain known as the default mode network, or DMN. For many individuals, the DMN is the most active region of their brain. It is responsible for everything from introspection and daydreaming to thinking about our future and past. It is the mirror image of our task-focused network, coming to life every time you fail to focus on a specific job or chore. While undoubtedly enjoyable, excessive DMN activity has been tied to several mental health issues. However, with psychedelics, individuals suffering from these conditions can enjoy what's known as ego dissolution. This is where one's worries are reduced, so that the brain can form new connections, unlock new areas, and generally better itself without so many distractions. Obviously, the ability to create such a state has major ramifications for the field of psychiatry. The potential of psychedelic therapy. When a person is under the influence of a psychedelic substance, they are often very easy to influence. This means that a therapist might be able to guide the patient's trip in a way that reduces their depression, unlocks past trauma, or treats some other mental ailment. Such a treatment plan would most likely involve a consultation to identify the goals for therapy and to provide guidance on how to counteract negative experiences while under the influence. Therapists would then provide doses of the psychedelic under full supervision, directing the patient the entire time. The most important aspect of psychedelic therapy is the follow-up session, in which the patient is shown how to integrate their psychedelic experience into their own life. This is the primary model being used in current studies, and is highly focused on allowing patients to harness their trip to alter their mood for months, even years after their initial session. Compared to antidepressants, which a patient will need to take day after day to see results, it becomes clear that psychedelics have a lot of potential. Moreover, they will not result in sexual dysfunction, weight gain, and other problems largely associated with medications. Is it too good to be true? It's understandable that one might assume a drug with such a dangerous and seedy reputation might be habit-forming or dangerous. However, studies reveal that psilocybin trips are not as addictive as previously thought, despite their admitted intensity. In fact, the current thinking on the subject is that psilocybin trips are perfectly safe. According to one Imperial College of London professor, drugs like ecstasy and LSD are much safer than something as common as alcohol. Though most experts agree, psilocybin's Schedule I designation still forces patients to receive the drug via medical trials. For good or ill, a number of rogue therapists have started offering guided therapy illegally, with most patients reporting positive experiences. Of course, one of the main issues with sourcing psilocybin is that the product itself is highly unregulated. This makes it difficult to create an accurate, consistent dose. The drug's illegality also leaves patients susceptible to underground therapists, with no license or training looking to make a quick buck. All in all, any application of psilocybin that takes place outside of clinical studies do nothing to further the cause of psychedelics as a treatment for mental illness. Unfortunately, with legislators so slow to make changes to the laws, the problem of back-alley therapists and poorly regulated psychedelics will likely continue. The future of psychedelics. Though some experts argue that psychedelics should be made legal for use by the general public, others remain steadfast that these should not be treated as recreational drugs. Indeed, the overuse of psychedelics can negatively affect one's life in a variety of ways, not to mention getting one in trouble with the law. Currently, the consensus seems to be that psychedelics should be taken under close supervision and with the guidance of a trained professional. With some luck, a commitment to this manner of use will result in their being downgraded from Section 1 to Section 2, giving psychedelics a similar classification to medical cannabis. Of course, it's also important to consider how much influence the government should have over scientific advancement. We should also do our best to learn why stigmas exist regarding certain plant-derived medicines and not others, so that we can advocate and push for change in the future. Ultimately, psychiatrists all over the world have a responsibility to explore any and all avenues for helping their patients, regardless of public or governmental opinion.